depression clip number 3. So what sort of things would cause depressive illness? Well, there are many, many causes, similar to the causes for why people get down in the dumps just on a normal day-to-day basis. So we know that, for example, when people have overwhelming stresses, and the stresses, it's important to note, can seem overwhelming to them, even though outsiders might look at it and say, there's nothing really to worry about. Why are you worried about your car being broken down? Why are you worried about this, that, and the other? It's just a minor thing. But to the person who's caught up in the illness, sometimes you can lose a little bit of perspective. And so something like a car breaking down and therefore not being able to travel around and do the shopping may seem a very big deal. So the degree of how stressful an event is, or events are, which are causing or contributing towards the depressive illness, is gauged by the patient and not by the people around them, because they may not understand how stressful that event is for somebody. So, for example, the continual stress of looking after children might seem very mild and almost insubstantial to a woman's mother-in-law. I looked after 7 kids, why can't you look after 2? But to the woman looking after 2 children, she may find it absolutely overwhelming and exhausting. So once again, it's graded by how severe the patient feels it is, rather than how severe an outsider would. Most people have a threshold above which, if you push them too much with stressful events, they will start to become unwell. All of us have a threshold, in fact. And that threshold is not a measure of how strong or weak a person you are. Particularly once the depressive illness has started to kick in, then things which seem relatively mild stresses can become absolutely overwhelming and lead to depressive symptoms rather than just feeling a bit low. But also doctors know that contributing factors to whether a patient becomes depressed or not, no doubt some of them are a patient's personality. So you may be more vulnerable to getting depressive illness if, for example, you have a history of feeling as though you have rather low self-esteem, that you've never really been told that you're anyone special, you've often been put down as a child, or by your husband, or by your wife. We know that genetics play a part, so we see depressive illness runs in families. And interestingly, you see it in families where there are non-Muslims and Muslims. So I've come across families where there are Muslims and non-Muslims in the same family, and both the Muslims and non-Muslim family members have become depressed. Other things that can contribute towards depression are things like loneliness, isolation, and this is particularly a factor in young mothers, whichever country they're in. So particularly if they've recently had babies, or if they have young children, or if they have lots of young children, then not having any support from outside people can be a very powerful trigger for the mood slipping down. We know that some people become depressed despite never having had any other risk factors after they've given birth. And this is very common. We see this as GPs all the time, that patients have, at the very least, a form of what we call baby blues, where their mood goes down. They just feel blue in mood, they just feel low in mood. But that can go into actual clinical depression, which can be long-lasting. Obviously, things like alcohol and drugs can contribute towards depression. Alhamdulillah, may Allah protect us from those. Physical illness can contribute towards depression as well. So patients, particularly if they have an incapacitating illness, like if they have a stroke or a sudden loss of function, a heart attack, which means they can't do things which they used to do, a stroke, which means they're paralyzed, a diagnosis of diabetes, which means they have to radically change their diet, they have to cut out a lot of things which they used to enjoy. Physical illness can contribute towards depression. But sometimes we find that there's no cause, and sometimes we ask the patient, is there anything that's making you feel down? And they say no, and they start to cry because they say, I don't have anything that's getting me down, which makes me feel even worse. You know, if I had something that was getting me down, at least I could say, this is the reason why I'm feeling depressed. I don't have anything, my life is good, I've got enough food, enough this, enough that. And even in that case, we are still able to diagnose and treat depressive illness if it's causing problems for the patient, even if we can't identify any trigger. The reason for talking about triggers is that clearly one of the main ways that we would try and treat depression is to remove the trigger. or help them with the trigger, even if the trigger can't be removed. So a patient clearly can't change their family history. There's no way you can change that. But they can change, potentially, if they're a new mother or they've got lots of young children, they can change the support network they have by getting other family members involved, by getting friends involved once or twice a week to look after their children while they have a rest, etc., etc. And sometimes, particularly in mild depression, we find that this can help to treat